Hi, I'm Judith. I'm a volunteer with Project Let's.
Hi, my name is Beatrice and I'm a volunteer with Project Let's. Today we're making this video series to help clear up some misconceptions about suicide and to help people support their loved ones who are having suicidal thoughts.
We're going to be talking about imminent risk and what it means for someone to de-escalate a situation, because calling 911 shouldn't be the knee-jerk reaction.
In order for a suicidal person to be considered an immediate risk to themselves, 3 things need to be in place. 1, they have the intent or the desire to kill themselves. 2, they know when and how they are going to do it, they have a plan. And 3, they already have the means for carrying out that plan, so if they hope to use weapons or drugs, they have already obtained the weapon or the drugs. If you're talking to a friend and they have the intent, the plan, and the means to kill themselves, then they need help immediately. So what can you do? First, stop, take a few deep breaths, and don't panic. While it's scary, you don't have to do this alone, and the person that you are helping is probably a lot more afraid than you are. Hear this other person out and show them compassion. Try to shoulder some of the pain for them in that moment, and try to help them feel heard. A lot of the times when someone is helping somebody in crisis, they can start to feel scared too, and as a result, they give ultimatums and orders and don't show them the compassion that they need in that moment. This can cause a person in crisis to shut down, and it can make it difficult for any crisis services to get involved. Try to make the environment around the person as safe as possible. Start by having somebody physically present with them, preferably more than one person so that you can work in shifts and consult with each other. If you're talking to this person over the phone, or if you can't get to them, then send a text message to a family member or a friend who can get there.
Tell the person in crisis what you're going to do before you do it, and give them options about who you can contact, who to connect them to. Ask them to remove the means of suicide. And again, in terms of presenting options, you can ask someone if they'd like to flush the pills down the toilet, for example, or if they would prefer you to hold on to them.
Help to meet the needs of the person. Food, water, and medication. Also, sleep can really help somebody in crisis, so maybe try to make the room more comfortable, adjust the lighting, ask them if they would like to hear some relaxing music. Ask the person if there is any medication that could help them to sleep. It's always really important for anybody involved to stay calm, because if not, then the person in crisis will not be able to rest either. So we talked about how it's important to help that other person feel heard, but it's also helpful to connect them with others. Offer to call a friend or a family member, or ask if you can text their therapist if they have one. When a person is having trouble verbally expressing themselves, then writing and art may also be helpful.
Come up with a plan with that person to seek out formal mental health care, or having a plan that family and friends will check in the next few days. Again, the most important things to do in this situation is to remove the lethal means of suicide, have someone physically present with that person, and also getting that person to rest or sleep if possible. The SLAP acronym can help assess risk associated with someone's suicide plan and help you determine the next immediate steps to take. So when considering a situation, you have to consider the specificity of the plan, the lethality of the means, access to the means, and proximity to others. So SLAP. So with that, here's a quick recap of today's video. First, someone is an immediate risk to themselves if they have 3 things. So the intent to kill themselves, a plan to kill themselves, and the means to do so. Have someone get to that person as quickly as possible and try to have that person remove the means of suicide. Give that person space to express themselves, meet physical needs. A lot of times sleep can be really helpful. Be honest about whatever you're going to be doing, even if you're worried that it'll make the other person upset. Often going behind someone's back can damage their trust in you and their trust in mental health care services. Offer the suicidal person as many choices as possible. Often when people are suicidal, they feel like they don't have a lot of choices. This person's probably really scared and in a lot of pain, and so you have to talk to them as a human being and avoid ordering them around and being kind in general. Thank you for caring for each other.